Medicine is the quiet reason millions of us still stand each morning. It steadies the trembling hands of age, eases the pain that would have ended lives a century ago, and keeps hearts, lungs, and minds working long after nature's plan. On every bathroom counter, there's proof of that miracle: bottles, blisters, capsules, colors, each promising a little more time. But everything that saves can also wound. The same pills that guard us can, when mismade or misused, unravel the very health they were meant to protect. Sometimes the harm isn't loud. It hides behind a familiar label, waiting for one more swallow before it strikes. Today we open that cabinet and look closer. 7 medicines once trusted, now recalled for safety failures that should never have happened. And for everyone pulled from shelves, we'll show you the better, safer way to keep your health intact. 1. Painkillers. We were told they were harmless. Over-the-counter painkillers sold by the millions, wrapped in familiar colors that promise comfort and control. Every label says trusted for decades. Every commercial assures safety. But that belief, like so many others, needs a second look. Because painkillers are not harmless. They are powerful chemistry disguised as convenience. A single tablet must survive heat, moisture, and time without losing potency, and that requires manufacturing precision at a microscopic scale. When that precision slips, the line between cure and harm vanishes fast. The truth surfaced quietly this spring. The Food and Drug Administration announced that several batches of generic acetaminophen and ibuprofen tablets were being pulled from shelves after routine inspection found metallic contamination. Millions of bottles had already reached homes before the news broke. A small error magnified through industrial speed had turned daily relief into a potential hazard. Each recall notice reads like a confession written in fine print. The agency called it a moderate health risk, meaning the danger was real, but not yet catastrophic. Still, even a speck of steel hidden in a pill is a reminder of how fragile the system can be. People think factory recalls belong to cars or electronics. Few expect the same word to appear beside the medicine they take for a headache. It changes everything. However, the problem runs deeper than one company or one batch. It reveals what happens when efficiency outruns oversight. Production lines that never stop, supply chains measured by speed rather than care, and inspection teams stretched thin across continents. Moreover, the rise of online pharmacies has widened the gap between what is recalled and what still circulates. By contrast, a single outdated listing can keep selling for months before algorithms catch it. In truth, what this recall really exposes is our collective dependency. Painkillers are among the most frequently purchased drugs in the country. They're taken for arthritis, dental work, migraines, cramps, and the invisible wear of age. We keep them in our cars, our desks, our handbags. They are the rhythm of modern endurance, swallowed without a second thought. The habit feels innocent until the routine breaks. That break came with the crack in routine. It is small, almost silent, but once you see it, you cannot unsee it. Most people will never check a lot number. Few will read the recall notices tucked inside a government website. Yet this is the new reality of mass production, where the line between protection and exposure depends on vigilance, not assumption. Regulators can issue alerts, but only consumers can remove the bottle from the drawer. Painkillers remain essential, but their safety now demands participation. Look up the recall database before refilling a bottle. Ask a pharmacist to confirm batch codes. If the label looks worn or the seal broken, discard it. Do not keep medicine whose history you cannot trace. The cost of caution is tiny compared with the cost of blindness. The irony is that none of this is new. Similar warnings appeared years ago after contamination in vitamins, cough syrups, even saline solutions. What changes is how quickly we forget once the headlines fade. Convenience always finds a way back onto the shelf. And that is where the story lands, not in panic, but in proof. The recall is real. The risk is documented. The remedy is awareness. Because in the end, safety is never automatic. It is earned, inspected, and verified with every pill that passes from factory to hand. 2 children's cough syrup. It started with a sound every parent knows. A soft cough in the dark, the kind that carries through walls and makes you sit up before you even know you're awake. You reach for the bottle you've trusted for years, twist the cap, pour a small spoonful, and whisper, "It's okay, honey. This will help." The sweetness fills the air, the child breathes easier, the night quiets again. That scene has played out for generations. Each bottle promises the same thing: gentle relief wrapped in honey and flavoring that feels safe enough to call medicine. Parents hand it over without hesitation because sweetness feels like care and care feels like safety. But sometimes sweetness is just a disguise for what went wrong inside the bottle. In June 2025, the recall arrived without warning. MedTech Laboratories announced that several lots of its popular honey-based cough syrup for children were contaminated with Bacillus cereus, a bacteria known to cause vomiting and fever in small bodies. The product had been sold nationwide through both pharmacy counters and online listings long before anyone realized the risk. Meanwhile, the warnings arrived quietly. The company described the recall as precautionary. The FDA used the phrase potential contamination. Yet the language softened what was essentially a betrayal of care. The syrup that symbolized comfort was now something to be thrown away. Its sweetness turned sour overnight. However, it is not the first time children's medicines have been caught in this loop of failure. A decade ago, glycerin imported for cough syrup production in several countries was found tainted with toxic diethylene glycol. History repeats but quieter each time, as if repetition can dull the shock. By contrast, parents remain the last checkpoint between an innocent cough and an invisible risk. In that moment, the spoon of comfort becomes something else entirely. Not a promise, but a test of vigilance. Every recall like this exposes a deeper problem, the illusion that children's products are somehow protected by extra care. In truth, the oversight is the same, the machinery the same, the cost pressure the same. Pediatric medicine is a business before it is a blessing. Sweet flavor, cute labels, cartoon mascots, they all build trust faster than any data sheet can. Yet in the factory, safety depends on cleanliness, not design. Most parents will never see that side. They see the aisle of options, the bright yellow label, the words natural honey, and feel reassured. The reality is that contamination can hide anywhere in unsterilized mixing tanks and imported ingredients, even in the water used to dilute the formula. The chain is long, and one weak link breaks it for everyone. Children's medicine has always been about faith. We give it because we have to believe in something that helps. But faith without checking is just habit. And habit is what allows danger to grow unnoticed in the dark. So what can parents do now? Read the lot number printed near the cap. Verify it on the FDA recall list. If the syrup has sat in the cabinet for months, replace it. Newer glycerin-based formulas have stricter microbial testing and fewer flavoring additives. Ask pharmacists for brands with domestic ingredient sourcing. They are often safer even if they cost a little more. Ironically, the medicine meant to protect the smallest lives has revealed how fragile protection really is. The same sweetness that once quieted the night now echoes as a warning. Because comfort left unchecked can turn bitter faster than anyone expects. 3 allergy tablets. Let's look at the numbers first. Nearly 1 in 3 adults in America now relies on allergy medication during spring, and more than half of those users take it year-round. The market looks clean, regulated, predictable. But inside that stability, a strange pattern emerged, recalls, reformulations, and unexplained reports of irritation that appeared not before taking the pill, but after stopping it. The data kept piling up. Data rarely lies, yet it rarely shouts either. It whispers through reports and safety alerts, and the ones from the past few years tell a quiet, uncomfortable story. In May 2025, the Food and Drug Administration issued a notice acknowledging cases of severe itching after discontinuation of popular antihistamines like cetirizine and levocetirizine. The agency added new label warnings and asked manufacturers to investigate production variances in certain imported lots. Moreover, several batches of generic allergy tablets were later recalled for failing purity standards under CGMP, the very framework designed to prevent cross-contamination. However, few consumers noticed. Allergy pills live in a category that seems invincible. They are small, cheap, and easy to find, so dependable that most people forget they are drugs at all. You pop one after mowing the lawn or dusting the attic and expect the world to clear up, and it does until it doesn't. By contrast, the itch that returned after stopping the medication wasn't an allergic relapse. It was the body reminding us that chemical comfort has terms and conditions. Pharmacists call it a rebound effect, a temporary surge of symptoms as the body recalibrates after constant suppression. It fades with time, but it can feel worse than the original allergy itself. In reality, this side effect is more than a biological quirk. It's a mirror of our habits, how easily short-term relief becomes an unspoken dependency. A tablet a day, then another. and soon the act of taking it feels like routine maintenance rather than therapy. One pharmacist explained it simply: people think allergy medicine is seasonal, but once you use it daily, you train your body to expect it. A pause followed. Then came the sentence that mattered more. It's not addiction. It's adaptation. That line stayed, because adaptation is exactly what we forget to measure. We count pills, not reactions. We track sales, not withdrawals. The data hides in how we behave, not just in what the FDA prints. Meanwhile, manufacturers adjust their processes, rebranding the same molecules under new names. The cycle feels clinical, efficient, inevitable. Yet behind the numbers, a truth still lingers. Purity checks fail, imports vary in quality, and oversight stretches thin as global demand grows. When safety becomes a statistic, discomfort becomes routine. That is where the breath of truth enters. It clears the dust around an industry that thrives on repetition. It reminds us that relief is not supposed to itch back when it ends. Allergy tablets remain essential, but they require awareness that outlasts the pollen count. Ask your pharmacist if your brand was recently reformulated. Check expiration and origin. Some foreign-sourced lots face stricter inspection delays. If a symptom feels new, report it. It counts more than you think. Observation is the bridge between safety and complacency. The recalls prove that even the smallest pill can carry a story larger than its label, and the quiet truth of this one is simple breathing clear should never come with hidden terms. 4 blood pressure tablets. It began quietly, as most things in medicine do: a line on a spreadsheet, a test batch, a green light from regulators. Months later, the same line appeared again, but this time shaded red. That was the moment the recall began. What started as approval had turned into alarm. Blood pressure medication is one of the most tightly controlled drug categories in the world. It must be exact, not close, not approximate. A single milligram too much can drop a pulse below safety. A single milligram too little can leave the heart exposed. Precision decides everything. Yet in early 2025, precision itself faltered. A recall notice surfaced for generic carvedilol and diltiazem tablets after inspectors found potency variations that violated federal manufacturing codes. At first, the deviation seemed small, a few points off specification. But in drugs that dictate blood flow and heart rhythm, small deviations ripple fast. They can mean dizziness, fainting, or spikes that go unnoticed until the damage is done. Tiny errors, large consequences. However, the deeper problem was timing. The irregularities had been flagged months before action was taken, lost in paperwork between company testing and federal verification. Meanwhile, the pills remained on shelves, shipped and prescribed like normal. By contrast, patients kept taking them faithfully, believing consistency was guaranteed. For many, it was not. Pharmacists began fielding complaints of lightheadedness and fatigue among users of certain generics. The pattern wasn't visible until someone compared notes across states matching symptoms with lot numbers. That is how most drug recalls truly unfold, not through dramatic discovery, but through small fragments of evidence linked together too late. Ultimately, the issue was not malice, but machinery. Modern drug plants run around the clock, compressing millions of tablets a day. The more the machines work, the more calibration drifts. Regulators require regular checks, but human oversight can't keep pace with mechanical fatigue. Each extra hour of operation adds another layer of risk to something designed to be risk-free. And yet, patients rarely hear this story. They hear only dosage and instruction, never the history behind the pill's creation. Doctors prescribe, pharmacies dispense. The chain feels unbroken until it breaks. That break carries the weight of awareness. It settles heavy but necessary, reminding us that trust without inquiry is not protection. A single pharmacist described the recall best. The medicine still lowers blood pressure, just not predictably. And unpredictability is the worst kind of danger because you feel fine until you don't. The line is clinical, almost cold, but the truth underneath burns. Predictability is what every prescription promises. When it slips, control falters. The Food and Drug Administration eventually traced the error to calibration records and retraining failures at the plant. Corrective measures were issued, new protocols added. But for patients who had already experienced side effects, reassurance arrived too late. So where does that leave us? In a world where precision is preached, vigilance becomes our responsibility too. Check your refill label. Confirm the manufacturer name on your bottle. Pharmacists can tell you if your lot number was affected, and most will do it gladly if you ask. Medication safety is not static. It evolves only when attention does. We once believed oversight alone could keep medicine pure. Now we know oversight needs eyes beyond the lab hours. And that is the outlook worth holding. Because progress in health has never come from comfort. It comes from noticing the tremor before the fall and acting before the next red line appears again. 5 sleep aids. Every night begins with the same intention. You dim the lights, turn off the phone, and wait for the mind to slow. Stillness feels impossible, but silence is deceptive. The more you chase sleep, the further it drifts. That's when the hand reaches for what promises to help, the small blue tablet that claims to calm the storm. Psychologists have studied this for decades, how easily the ritual of sleep becomes the ritual of swallowing. The body stops distinguishing between rest and relief. One becomes the condition for the other. The pill is not just a sedative, it is a permission slip to stop trying. And for millions, that permission has become a habit. Night after night, bottle after bottle, until the sound of the cap twisting open feels like part of the bedtime routine itself. The mind calls it control. The chemistry calls it dependence. In truth, what we rely on to escape exhaustion often deepens it. Recent recalls on popular diphenhydramine-based sleep aids revealed trace levels of nitrosamine, a compound known to increase cancer risk when exposure accumulates over time. The discovery wasn't new, but it broke something sacred, the illusion that rest is a guarantee sealed in plastic. However, few people paid attention. Sleep medicine sits in the blind spot of health awareness. It is neither prescription-level serious nor casual enough to ignore. Meanwhile, production lines move fast to meet demand that peaks with stress cycles, holidays, and aging populations. In that rush, purity becomes a percentage, not a promise. By contrast, the recall came as a quiet footnote on pharmacy websites, just a paragraph under safety updates. No headlines, no outrage. Yet for every bottle returned, dozens stayed in bedside drawers, their risk hidden under the comfort of familiarity. Sleep should be natural, yet our biology has been conditioned by modern schedules, artificial light, and chronic stress. Tablets filled the gap where lifestyle failed. They were meant for rare nights, not every night. But scarcity became routine, and routine became reliance. It is an easy slide. In one consumer survey, over 60% of long-term users admitted they could not sleep without their chosen aid, even after weeks of normal rest. That statistic carries no scandal, no noise. It just sits there quiet like the pill itself. In truth, dependency doesn't start with danger. It starts with relief that works too well. And once the line blurs, the body forgets how to sleep on its own. The curtain of calm lowers each night, promising peace. Yet beneath it, the system keeps burning, adjusting, adapting, waiting for chemistry that may never truly rest. Experts warn that nitrosamine exposure is not the only risk. Prolonged antihistamine use in sleep aids can dull cognition, raise fall risk among seniors, and reduce natural REM cycles. But danger rarely feels dramatic. It feels comfortable until it doesn't. So where does that leave those who just want a quiet night? It leaves them with awareness and small steps that matter. Read the label before you refill. Check the expiration date printed on the box. Ask your pharmacist if your brand was recently reviewed for quality control, and if possible, rotate products to avoid long-term dependence. Keep the bottle out of reach, not within habit. And when sleep resists, try returning to rhythm before returning to pills. A dark room, slower breath, steady quiet. Because real calm is not manufactured. It is rebuilt slowly in the space between one heartbeat and the next. But the journey doesn't end in warning. After every withdrawal comes discovery, better choices built on cleaner science and tighter care. They don't promise perfection, only consistency. What sets them apart is not a logo, but disciplined formulas, tested ingredients, transparent, and production held to a higher calm. In a world of recalls and regret, there are still medicines that keep their promise, quiet proof that progress, when guarded, can still heal. 6. Safer relief. It begins with steadiness. No flash, no slogan, no miracle promise. Just a medicine that works as it should again and again. In a world where labels shift faster than trust, that quiet reliability feels almost antique. Yet it survives in the tablets that never needed an apology. Pharmacists know them by name. Low-dose aspirin, acetaminophen, ibuprofen, fluticasone, nasal spray. They sit on the shelves, unassuming, surviving wave after wave of new formulations and failed trends. These are not perfect drugs they can harm when abused, but they've earned their place through time testing and relentless regulation. The endurance itself tells a story, because medicines don't last this long by accident. Each has faced scrutiny from every direction, from the FDA's drug sampling programs to global reviews that track manufacturing consistency. Low-dose aspirin remains one of the most studied compounds in human history, credited for reducing heart attack risks when prescribed correctly. Acetaminophen, though delicate in dosage, has proven safer for stomach health than many stronger analgesics. Ibuprofen, the middle ground, offers inflammation relief without long-term dependency. Fluticasone, the nasal spray that quietly clears airways, stands as one of the few over-the-counter steroids that passed its decades-long safety checks with minimal side effects reported. However, survival alone isn't proof of safety, it's maintenance. These medicines remain reliable because their manufacturers never stop tightening quality controls, revising packaging seals, testing ingredient purity, and tracking batch-to-batch consistency. Moreover, regulators learned the same lesson consumers did: trust cannot be inherited, it must be renewed. Meanwhile, pharmacists, doctors, and even patients became the watchdogs who kept these names honest. What makes them safe is not luck, it's the discipline behind them. Factories that make these everyday medicines are inspected more frequently than some prescription lines. Random batch testing is mandatory. Temperature, pH, and moisture levels are recorded for every production cycle. That is what calm looks like in chemistry. In this routine, vigilance, a form of reassurance, emerges. The medicine we take for granted is often the most dependable one. And while headlines praise novelty, these familiar tablets persist because they don't chase trends, they serve function. By contrast, newer painkillers and sleep aids often enter with grand claims and leave with recalls. But the quiet ones remain: aspirin, acetaminophen, ibuprofen, fluticasone, enduring the decades not because they are flawless, but because their flaws are known, studied, and managed. That is the hidden difference between confidence and chaos. The quiet proof rests in their longevity. It's not the absence of warning labels, but the presence of stability through every era of medicine. In the end, these survivors teach a simple truth: safety grows from familiarity only when familiarity is earned. Every bottle that stands the test of time tells a story of restraint, of manufacturers who test more than they must, and consumers who learn to use less than they could. So what can we take from them? Perhaps a practice worth keeping: choose what's proven, not what's loud. Read labels, follow dosage, respect the limits that keep relief safe. Because medicine that endures doesn't only heal, it teaches patience too. And in that steady patience lies the true calm, not the promise of perfection, but the rhythm of care that never breaks. 7 saline sprays and antacids. What does safe medicine really mean? Is it the absence of chemicals or the presence of control? The question sounds simple, but it shapes every bottle, every blister pack, every shelf in the pharmacy. Because while new treatments appear every year, only a few old remedies continue to earn the title of everyday healers, the kind that doctors still recommend and pharmacists still trust. These are not glamorous drugs. Saline nasal sprays, calcium carbonate antacids, oral rehydration salts, they don't promise transformation, only relief. Yet that humility may be the secret to their survival. They don't alter the body, they help it recover its rhythm. That matters more than we think. Over time, that reliability became a quiet legacy. Unlike the flashier trends that rise and vanish, these modest helpers remain unchanged in formula and purpose. Their packaging may modernize, their labels may shrink, but what's inside still echoes the same care written decades ago. That is endurance in its purest form. The science behind them is not complicated, and that's the point. Saline sprays mimic the body's own moisture, clearing airways without dependency. Antacids neutralize excess stomach acid through basic mineral reactions, a chemistry lesson turned household comfort. Oral rehydration salts restore balance with a mix of sodium glucose and water, saving countless lives from dehydration worldwide. Simple ingredients, profound outcomes. However, their simplicity does not mean complacency. Manufacturers still submit these formulations to strict purity and stability checks, ensuring that the minerals dissolve as expected, the saline maintains sterility, and the glucose balance remains exact. Meanwhile, hospitals rely on these basics as their first defense tools, so common they almost disappear into the background of care. By contrast, many newer natural alternatives claim to replace these old reliables with fancy extracts or probiotic blends. But when real crises strike, fever, dehydration, blocked airways, it's not those new names that save lives. It's the saline, the salt, the chalky tablet that's been doing the same job for 50 years. Their resilience isn't nostalgia, it's validation. Every generation of testing has tried to find something better, and yet these few remain unchanged. Pharmacists often call them the quiet backbone of healthcare. Their safety profile is so strong that they appear in both home kits and international aid packs. The World Health Organization lists them not for convenience, but because without them, millions would lose their simplest form of defense against imbalance. And within that reliability lies the echo of care. Not the loud kind, not the heroic rescue, but the gentle presence of something that works without drawing attention. It's the medicine that waits in your cabinet until the night you really need it, steady, simple, proven. In return, these unassuming remedies remind us of a larger truth: health is often restored not by invention, but by remembering what already works. So perhaps the question isn't which drug is newest, but which one still earns its place after decades of use. Perhaps safe doesn't mean free from chemicals, but free from unnecessary risk. Because somewhere between innovation and tradition, these everyday healers endure saline antacid and rehydration salt quiet tools that keep the world upright, one breath and one swallow at a time. And maybe that's the real question worth asking. If the simplest medicines can last this long, what does that say about the kind of care we truly value? In the end, every medicine, no matter how pure or proven, is only a bridge. It steadies us, buys us time, gives the body a moment to remember how to heal. But healing was never meant to live in a bottle. It begins and ends within us, in the food we choose, the rest we allow, the care we give ourselves when no one is watching. Science can correct what's broken. Discipline prevents it from breaking again. The real shield isn't made of chemicals or capsules. It's built from awareness, balance, and patience, the quiet choices that strengthen us long before illness begins. So when you reach for that familiar pill, remember this medicine helps you recover. But the life you build steady, mindful, and kind to itself is what keeps you truly safe. That's not treatment, that's resilience.
This video does not promote division within the United States or encourage segregation. All content is presented for the purpose of exploration, analysis, and fostering discussion based on current events, public sentiment, and social trends. We fully respect the United States Constitution and all federal regulations. If today's analysis made you think, drop a comment so we can keep the conversations going. And don't forget to like, subscribe, and hit the bell so you will never miss our next independent deep dive.